Hi everyone. So today we'll be discussing a very important topic, and it's a quick revision for the upcoming NEET PG as requested by many students, that is important obstetric maneuvers. So we'll quickly just discuss the names and what they're used for. We won't go into too much detail. Okay, you can subscribe to my YouTube channel. I have my own classes by the name of OBG classes by Dr. Rena. I am also a senior faculty for Docami. You can find us on YouTube and on Instagram. So let's start with the Leopold maneuvers. Now, Leopold maneuvers, there are basically four maneuvers. Okay, the first, as you can see here, is the fundal grip. These are basically grips to determine the lie, the presentation, and whether the presenting part has entered the pelvis or not. So you can see the first is the fundal grip. The second down here is the lateral grip. The third maneuver is the first pelvic grip. And the fourth maneuver is the second pelvic grip, which is done facing the feet of the patient. And this grip is used to determine whether the head has entered the pelvis or not. These are the Leopold maneuvers. Next maneuver is the modified Ritgen maneuver. This is basically a controlled extension of the head. So you can see one hand is placed once the head is delivering so that the extension is not sudden, and this prevents maternal perineal tears. And the second hand provides pelvic support. So this is the modified Ritgen maneuver. The Pinard maneuver is basically when we're doing breech extraction. So the hand goes inside, and once we press below the popliteal fossa, the legs will come out. And this is called as Pinard maneuver, and then breech extraction can be done. Lovset maneuver is basically it is a maneuver in breech delivery when the aftercoming when the sorry when the there are nuchal arms. That means both the arms of the baby are above the head. So it becomes difficult to deliver the arms otherwise. So what is done is the Lovset maneuver, where it is basically a rotational maneuver where we rotate the baby and dislodge the arms. Next comes the different methods to deliver the aftercoming head of the baby. So we start with Burn Marshall technique. Burn Marshall technique is basically done to we hold the feet of the baby between the hands and sweep the baby over the maternal abdomen. This is Burn Marshall technique. We also give suprapubic pressure so that the flexion of the head is maintained. The other technique is this one. This is Morisot Smellie-Viet. One hand holds the malar, the face of the baby, the malar eminences and the chin, and the other hand maintains flexion along with suprapubic pressure. This is called Morisot Smellie-Viet. The Prague maneuver is also used in delivering the aftercoming head, but this we use when the back of the baby is posterior. So when the back is posterior, we uh, 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 we use the Prague maneuver. Bracht maneuver is also one of the rarer maneuvers. It is also used in delivery of breech, the aftercoming head. And this is basically by maintaining suprapubic pressure. If we maintain the baby in this position with slight traction, this encourages flexion of the head, and this is called as Bracht maneuver. Kristeller maneuver is basically fundal pressure. So you would have seen in second stage of labor, many times fundal pressure is given, but this is not recommended and should not be done because it leads to a lot of trauma to both the mother and the fetus. So Kristeller maneuver is fundal pressure, which should not be done. Then comes maneuvers for shoulder dystocia. This is McRoberts maneuver. McRoberts maneuver is suprapubic pressure. So what is shoulder dystocia? It is when the head gets stuck, when the shoulders get stuck. The head is born, but the shoulders get stuck. So what do we do? The first thing we do is McRoberts maneuver, where we give suprapubic pressure and we hyperflex at the hip joint and adduct there. So hyperflexion, adduction at the hip joint, and flexion at the knee joint also, along with suprapubic pressure. This dislodges the shoulders 90% of the times. If this fails, then we apply the rotational maneuvers. And in this, important to remember our Wood's corkscrew maneuver. So basically, what do? We try to dislodge the shoulder, the posterior shoulder, the shoulder of the baby. How do we do that? We rotate the posterior shoulder anteriorly in a clockwise direction, and then this sometimes dislodges the shoulder. We can take it out anteriorly. So this is Wood's corkscrew maneuver. There are other rotational maneuvers. You just need to remember the names. Rubin's maneuver is basically trying to move the baby, not completely 180 degrees, but slight shoulder. If it moves, if you're able to move the anterior shoulder slightly, that itself may dislodge the shoulders. If that fails, then we add the Wood's corkscrew maneuver. That is, we rotate it completely by 180 degrees. And if that also fails, we rotate it in the opposite direction. That is reverse Wood's corkscrew maneuver. Then is the Gaskin's maneuver. This is also an aftercoming head of the this is also used in shoulder dystocia. If the other maneuvers fail, we put the woman in all fours. So Gaskin maneuver is all fours maneuver. This also helps dislodge the stuck shoulders. Zavanelli maneuver is a last resort maneuver. When everything else has failed, we re-rotate the baby's head and push it back inside the uterus, inside the vagina, and then we deliver the baby by a cesarean section. So this is a last resort maneuver, rarely done Zavanelli maneuver. Last few maneuvers. One is this is Brandt Andrews technique. This is in the third stage of labor when you're delivering the placenta. It is basically controlled cord traction. We pull the cord from below and we give suprapubic pressure. This is to prevent uterine inversion. This is basically controlled cord traction or Brandt Andrews technique. These two methods of separation of the placenta, although they're not maneuvers, but I still put them here because they're useful. One is shiny Schultz, one is dirty Duncan. Shiny Schultz is when you can see the placenta comes out like this. So the fetal surface is seen, and this is called Schultz method, and it's called shiny Schultz because the fetal membranes appear very shiny and neat. So this is shiny Schultz. Dirty Duncan is when you can see the maternal surface appears first, and you can see the cotyledons here. This is dirty Duncan method. So these are a few of the maneuvers which are important for your exam. I hope this video was useful.